Across Ohio, more than 700,000 people have now been vaccinated. Nearly 500,000 are white, 180,000 are unknown or other, and just 34,000 are African American. The racial disparity here is on par with about a dozen other states, what they're reporting. Our Marielle Carbone digs into the numbers here, locally, and how health officials are working to address them.
Well, health experts tell me that yes, there is a disparity, but right now we're not vaccinating the general public, which does play a role in this. So until we get to that point, many health leaders are focusing on education and getting minority communities on board with actually getting the vaccine. More people are rolling up their sleeves every day, but the racial disparity among who those people are still exists.
17 states that have reported racial data, all 17 show that African Americans are getting the vaccinations less than whites.
Dr. Black Ohioans, CEO of Interact for Health, says African Americans are at a higher risk for getting and dying from COVID-19. And African Americans also lead in many underlying health conditions.
There should have been some recognition of African Americans in 1A, but you got to understand how political that is.
Phase 1A includes those in nursing homes, first responders, and medical professionals, which in part is causing the current disparity. Only 4% of physicians nationwide are African American.
Well, I don't know that worrying is what we need to do. I think what we need to do is ensure that we build equitable strategies.
To do that, Renee Mahaffey-Harris, president of the Center for Closing the Health Gap, says local organizations are using census data, including race, income, and transportation, to map out where vaccine sites are needed, plus building trust within Black and brown communities.
Starting with Black physicians that are trusted by their patients, starting with Black organizations that are trusted by the people who they serve.
She's helping build a vaccine toolkit to give to these organizations.
To help people understand how they sign up, where they can move to actually get the vaccine, questions about things you're hearing on social media about what the vaccine is and isn't.
And both Owens and Mahaffey-Harris say that yes, they could get infrastructure in place and they could get people on board with being vaccinated, but one thing they can't overcome is a shortage of vaccines. So they say that's the real solution here, getting more doses. Reporting in Corryville, I'm Marielle Carbone, WCPO 9 News.